share just the details of how each individual patient had these insecurities about their calves that they needed some help, and you were able to just totally adjust that for them and change their lives.
A common reason why somebody would have, say, a problem with the calf muscle is, for example, polio. I have one patient who thought, she believes, she grew up in Vietnam, and the health conditions weren't as they are in the United States. The water purification and that sort of thing is not the same. And that's where polio is more of a problem. And they believe that she had polio, and it just affected that part of her cord, spinal cord, the nerves, that went to one of her calves. And so she had underdevelopment of that calf muscle. Now she's, for whatever reason, she loves to bicycle. She really loves to bicycle, and we've all seen the people that, or those bicycle riders on the side of the road on a Saturday or Sunday morning, and they've all got humongous calves. Right. And you know, this is something that whether she liked that sport or not, she was always really very self-conscious about. That it was very different. Probably maybe a third of the volume was missing from that side compared to the other. It really significantly limited her wardrobe selection, for one, because she really had to make sure that the wardrobe choices that she made didn't do anything to really enhance or, you know, bring additional attention to her legs.
And for her it'd be noticeably different because she has one calf that's actually perfectly formed, but the other one was...
Correct. Correct. And there's another patient that had really the same problem for a different reason. She, they think that she had a variation of cerebral palsy. And I mean, this is a very bright gal. She's a school teacher, and they think that it was something that in the womb affected just this particular limb. So she also had just one calf that was very small, about half the size of the other side. She related to me a story where she was either sad or she had questioned her parents or questioned her father, and her father basically gave her the answer that she was hoping she wouldn't hear. But he basically said, you know, you just will never be able to wear dresses. You're going to have to get over it. You know, that you'll have to just wear slacks. And because she was so self-conscious and maybe she was getting teased or taunted. You know, her leg worked very well. She didn't really have a limp, a noticeable limp, or any other problems with that leg, but just very noticeably different. So, you know, she thought that for the rest of her life she'd be confined to just wearing slacks and not able to show her legs.
And that would definitely be a feeling of like entrapment almost, that she was not free because she had to stay within those guidelines because her dad told her.
Right, right.
But then you shared with her a way she could be free.
Exactly. Well, I mean, I think it's more than that. Think about, you know, hanging out with friends, and friends say, hey, let's go to the beach.
Right, especially when you're young.
You know, or you know, go to somewhere where it's really warm. And, hey, why are you wearing long pants? You know, we're all wearing shorts. You know, what's the deal? And so, you know, she had to really think ahead and think about, well, what am I going to say? What you know, what's my story for, you know? I'm sure she got, you know, some pretty imaginative in her stories, but I'll bet you that people knew something was going on.
Right.